Hey everyone, this is Dr. Glickman from CFNC Raleigh, and today I'm going to be answering some frequently asked questions about migraines. The first question I want to answer here is, what is a migraine and what differentiates it from just your typical run-of-the-mill headache? The first thing I want to address is that migraine itself is a neurological condition rather than just head pain. While most migraineurs do experience some type of throbbing head pain along with their migraine, there are a lot of other symptoms like nausea, light sensitivity, sound sensitivity, visual disturbances, dizziness, gut pain sometimes, as well as a whole host of other things. Now, what causes a migraine is also a little bit more complex than your typical headache because the actual cause of the migraine has to do with the way that the brain is processing sensory information, the way it's regulating blood flow, as well as the way it's processing inflammatory responses within your nervous system. So as you can see, the migraine itself is a little bit more complicated than just the head pain that we get from your run-of-the-mill headache. So what actually causes a migraine event to happen? The reality of the situation is that there are a lot of different triggers to migraine. However, the underlying cause often is that we have dysregulated and overactive brain pathways that are becoming more and more sensitive over time. The brain pathways in particular that I'm talking about are the visual pathways, the pain perception pathways, as well as overall autonomic functioning. Other things that contribute to migraine are stress responses, sleep quality, nutrition and metabolic state, as well as other previous injuries that can actually activate these pathways and make them more sensitive to sensory stimulus. What do we at CFNC do to evaluate a patient with a migraine? What we do at CFNC is take a comprehensive neurological approach in order to identify the systems that might be involved in the changes in brain pathways that are contributing to your migraine. What those evaluations might look like are testing of your oculomotor function or your eye movements, testing of your autonomic function, testing of vestibular therapies or vestibular functions, as well as musculoskeletal therapies, looking at metabolic markers, as well as other structural or functional things that could be contributing to the buckets that are overloading the brain systems that are causing the migraines. Now, with that information, we can reverse engineer and tailor a specific treatment plan for you that will address all of the systems that are contributing to the actual sensory overload that is causing the headache. What does treatment look like at CFNC for a patient with a migraine? In general, treatment plans at CFNC are fully individualized to the patient and what we found on their exam. But in general, what we do here is neurological rehabilitation aimed at retraining eye movements, retraining vestibular function, retraining autonomic regulation and integration, sensory desensitization, musculoskeletal exercises, as well as doing things like nutritional and metabolic support, maybe some supplementation, as well as other things like red light therapy, pulse electromagnetic frequency therapy, neuromodulation techniques with things like neuromodulatory devices and peripheral nerve stimulators, as well as many other things that might be called for based upon what we find in your exam. But really the overall goal is to increase the capacity in your brain pathways that might be leading to the overload of the headache itself and why the migraine is being caused. So if you want to learn a little bit more about the specific therapies that we use, you can visit our website at carolinafnc.com and look at our migraine section.